Welcome to yet another edition of COVID-19. I'm Min Son-hee. The race continues for a vaccine against the virus, and we take a look at the status quo in today's studio session. We start the program now with the latest figures on the pandemic with our Kwon So-ah and related news with our Kim Da-mi. So what are the numbers for Korea on this Tuesday?
Well, Sunny, we have quite a surge in cases today, this Tuesday, after recording some of the lowest figures just the day before.
And so I hear that the reason for that is because we see a rise in local infections here in capital Seoul.
Exactly, and that is largely due to a cluster infection at a nursing home in the western part of Seoul with 9 new related cases. And with that, along with these 9 new infections, the capital Seoul has the most infections today with 21 cases, and 18 of those were local cases. Also, a local case was reported in Gyeonggi-do province and down on Jeju-do Island, and the rest of the cases were imported cases that were either detected at the airport or seaports or during the self-isolation period. So 20 local cases and 20 imported cases. That brings today's caseload to 45 and the total accumulation to 13,816. The death toll remains unchanged at 296. While people in quarantine, the number here has dropped to below 900, and 12,643 people have now made a full recovery, with 71 more people discharged from treatment or hospitals. And compared to yesterday, if we go over to our graph, we unfortunately have a rise by almost 20 new cases. Now, with these 45 cases, it looks like that's pretty much the average we are seeing throughout the past week. And now let's shift over to the situation on the global front. We have in total 14.85 million cases with over 200,000 new infections. The death toll stands at over 613,000 as of noon Korea time, with more than 8.9 million recoveries. And let's move over to the most affected countries around the world. The U.S. here with approaching 4 million total cases, followed by Brazil at 2.1 million and India at 1.1 million. And here in South Africa has surpassed the 5,000 mark, that is, when it comes to fatalities. Let's move over to other places around the world. Mexico here at 349,000 cases, followed by Chile and Spain with similar figures around the 300,000s. And here the UK, 295,000, followed by Iran and Pakistan at 276,000 and 265,000 respectively. And those are the updates I have for now, but I'll be back after the government briefing. Sunny?
All right, so thank you. I'll see you back at the desk. One of the key pillars of the Korean New Deal is green, aimed at addressing climate change and boosting sustainable and environment-friendly economic growth. For more on this initiative, I have our economics correspondent, Kim Da-mi, here in the studio. Welcome, Da-mi.
Good afternoon, Sunny.
Right, Da-mi, Korea's New Deal is all about going digital and going green. I hear Seoul's environment minister has addressed the timing of this project.
Right. The South Korean government says now is the most appropriate time to roll out the 5-year, $61 billion spending plan. It hopes the Green New Deal will be a stepping stone for the nation to take the global lead and prepare for the post-pandemic era. Let's take a listen.
The Green New Deal aims to overcome both the economic crisis caused by COVID-19 and the climate and environmental crises that caused the pandemic.
Plus, the government notes the climate and environmental issues that have emerged during the global crisis are hinting at the need for a structural paradigm shift. With the Green New Deal, South Korea aims to transform itself into a global pacesetter and lead sustainable, eco-friendly growth in the post-pandemic era, which includes the goal of net zero carbon emissions.
Right, Tammy. Now, for more details on how the government plans to achieve these goals, a part of the plan I hear includes building green smart schools. Please tell us more.
Right. So as we all know, remote learning has become part of the new normal now. And to better suit such a learning environment, plans are in motion to convert old schools into smart, eco-friendly facility. Wi-Fi will be installed at all elementary, middle, and high schools nationwide by 2020. Around 1,200 public schools will get some 240,000 tablet computers. The government also plans to establish an online education platform utilizing big data that provides each student with customized education. Also, old public schools across the country will be remodeled into zero-carbon green schools. Topped with solar panels, these green schools will also be equipped with energy-saving infrastructure.
The Moon administration will successfully establish green and smart future schools so that our children can grow and learn in a happy environment.
Right, Tammy, I hear it's not also just the schools. The government is
Right.
also planning to remodel public facilities.
Exactly. So to further encourage energy efficiency, a wide range of public facilities will be retrofitted with eco-friendly power and materials. For example, old healthcare centers will be equipped with solar panels and eco-friendly materials like energy-efficient insulators. Around $4.5 billion will be poured into the endeavor with the hopes of creating 120,000 new jobs.
Right, now let's talk about the country's plan to ease its carbon footprints over the next 5 years. Our main source of energy will shift from fossil fuels to renewable sources. Tell us more.
Right, so renewable sources, mainly solar, wind, and hydrogen, will be the country's go-to energy source. And specifically, South Korea will bet on the eco-friendly future mobility market.
Despite the downturn in the global auto market amid COVID-19, Korea's electric car and hydrogen car sales in the first half of 2020 rose by around 80% and 70% respectively. The government will exert all efforts to turn our eco-friendly car industry into a global leader.
More eco-friendly future cars will be secured, including over 1 million electric vehicles. South Korea will supply 200,000 hydrogen vehicles and set up around 450 charging stations across the country. Electric cars also become a more common sight here in the country. The government will secure over 1.1 million electric cars, including taxis, buses, and cargo trucks. Research and development efforts will focus mainly on electric car components and fuel cells for hydrogen cars. In addition, 3 new hydrogen cities will be constructed in Korea to further support the development of hydrogen technologies. The government will also adopt green technology for buildings and city infrastructure with the aim of establishing 25 smart green cities nationwide. That includes building over 1,700 green factories with emissions-reducing technology. Also, 9,000 facilities that reduce fine dust at small factories will also be newly installed.
All right, Tammy, thank you for sharing details of the new Green Deal with us. Hope to speak to you again soon.
My pleasure.
Right, we turn now to the regular government briefing on COVID-19 here in Korea. Health authorities have revealed a list of essential tasks in light of the prolonged fight against the pandemic. The first involves research efforts to find a cure for and vaccine against the virus. The second is aimed at strengthening medical capacity in the case of a surge in COVID-19 patients, especially for those who are critically ill. The third task seeks to ensure better protection for those in high-risk categories, including the elderly, at nursing homes or at related care centers. The fourth calls for the incorporation of an effective social distancing practice into the public's daily life. The latter calls on members of the public to abide by personal hygiene practices and other safety measures, including the wearing of face masks, the ensuring of a healthy distance from those around them, and the avoiding of crowded and confined spaces. Meanwhile, a growing number of Koreans are choosing to travel within borders given the raging pandemic, and this preference is putting local tourist venues on high alert. Now, among the popular destinations are Korea's southern resort island of Jeju and the North and South Cholla provinces, which have the lowest COVID-19 cases in the world, that is, each under 40. Officials are calling for members of the public or potential travelers to these places to refrain from visits should they feel sick and to abide by strict social distancing measures if they do choose to travel to these places. We're still waiting for the briefing to start, and perhaps while we wait, we can take a look at today's numbers for Korea on this Tuesday. Korea had 45 new infections, raising our total number to 13,000, that is, 816. From the 45 new cases, we have learned that 25 are imported, and 20 of those cases are local infections, given a cluster infection at a nursing home in Western Seoul, raising the cases there to 9. Meanwhile, we have no death. The death toll here in Korea on this Tuesday remains unchanged at 296. Those in quarantine stand at 877, while 71 have fully recovered from COVID-19 here in Korea to raise our number of recovery to 12,643. The briefing is poised to start now. We'll come back to you afterwards with a summary of the key announcements.
First of all, here is Deputy Director Kwon Junuk with the briefing. Let us now begin our regular briefing for July 21st, Tuesday, on the COVID-19 situation here in South Korea. As of today, midnight, we have 20 new local infections and 25 new imported cases. The total number of confirmed cases now stands at 13,816. 71 more people have been discharged following full recovery, while 877 people are in quarantine undergoing treatment. The number of patients with critical conditions stand at 21, while there were no additional fatalities. Here are some updates on our domestic infections in the Seoul metropolitan city. In relation to office in Gwanak-gu's district, we have one additional case. In total, we have 34 cases so far. And in relation to a care facility in Gangseogu district, Seoul City, we also have additional cases, with the total rising to 12. And in Gyeonggi-do province, in Gwangyang City, we have a Su clinic, and we have additional case, increasing the total number to 6. And in relation to the patient number 60 for Songpa-gu district, we have a total of 12 people being confirmed in relation to this patient. And the Gwangju city has put this patient under police investment. This was because this patient provided false information, and this delayed the process of contact tracing, thus increasing our risks of infections within the community. So therefore, we ask you to, of course, abide by and also cooperate fully with our epidemiological investigation efforts. And following, we also have some updates on imported cases. Out of the 25 imported cases, we have confirmed that 18 have been reported at the points of entry, while 7 were reported while they were on self-quarantine. And out of the countries, we also believe that 6 were from Americas, 5 from the USA, 2 from Europe, 2 from Africa, and 15 from Asia, excluding China, 4 from the Philippines, 4 from Kazakhstan, and so forth. Next, we have some updates on R&D efforts. And in relation to the plasma treatment for COVID-19, a total of 1,039 people have expressed their intentions to donate their blood samples. And in fact, a total of 660 people have finished donating their blood samples. And we also like to extend our deepest appreciation to all of these people who have donated their blood, and also to those who have identified their intention to do so. And we also ask for your continued support going forward. The COVID-19 treatment of remdesivir, which has been imported, we have been administering this drug to 76 people here in the country with critical conditions. Yesterday, we also had some report on this, but as for the plasma treatment, we have been starting our clinical trials and the development of the materials for clinical trials. And we believe that in early April, we will begin the actual trial. And as for the antibody treatment, after it has been approved on the 17th of July, we are currently in the phase 1 clinical trial on human beings. And next, we have some updates on the distancing measures put forth by the community. And marking the summer holidays, we ask for your precautions, and we ask you to go on holidays with small groups, only with family members, and please avoid crowded and confined places, and if possible, please utilize your own vehicles. And if when you are at the vacation destinations, please keep 2 meters of distance and please wash your hands at all times, and also wash your hands and wear your face mask. And also it is also important that when you are at restaurants or multi-use facilities, please also abide by the quarantine measures, including keeping a healthy distance. Last but not least, recently we have seen an outbreak that is centering around the nursing care facilities, which houses many elderly citizens. And after the end of May, we have seen numerous cluster infections relating to these nursing homes and long-term care facilities. And we have seen an increase of the number of patients and the number of fatalities. So if you are suspicious of the COVID-19 and if you work at these facilities, please do not go to work, and also keep your personal hygiene practices as well. And as for all of the new inpatients, we need to test them at all times. And if anyone shows symptoms, they need to be tested as soon as possible. And likewise, wearing face masks and other personal hygiene measures, as well as infectious disease control measures, are very important. Before we wrap up, we have a few words. Recently, on a daily basis, we are monitoring the trends here in Korea and abroad. And as for global cases, we are seeing unbelievable numbers. And especially for the countries that have great exchanges with our country and our neighboring countries, which are going through great numbers and exponential numbers of outbreak, we are also being alerted, and we also continue to stay vigilant. And in the USA, there on a daily basis, we have about 60 to 80,000 numbers of confirmed patients on a daily basis. And in Japan, we also have confirmed that they have seen over 1,000 numbers on a daily basis as well. And we need to look back on our past times, and also we need to thank all of our medical practitioners and all of the public who are participating in the quarantine measures. And it is time that we reflect on our measures and as well as prepare our future going forward. And South Korea, as of early May, we have seen cluster infections, especially centering around the metropolitan area. And we also took over 2 months to decrease this cluster infections. And this number has been reduced, and it is also a result of all of the efforts and endeavors put forth by the public from those times. And in order to make our efforts not be in vain, every single moment that we live in is very important. And we also believe that when we stayed complacent, these were the times when we saw great surge in the outbreak as well. And if we see another big cluster infections and massive outbreak, we are inevitably will be faced on halt in our daily routines. So that is why we need to continue to keep a balance of routine daily lives as well as quarantine efforts. The government will also exert our full efforts to this end. And we also have great reports on a possible second wave, as well as another resurgence during the winter, which actually increases our public fear and public nervousness. So do not be too nervous about these future that we don't know yet. However, continue to comply with quarantine measures and personal hygiene measures so that we can maintain the status quo, so that we will avoid and prevent such a nightmare going forward. And while we dealt with the COVID-19 throughout the past 6 months, we became well known about the COVID-19 virus, and we shall never repeat our errors. And the quarantine authorities will also continue to stay vigilant, and we will work around the clock as well. Thank you very much.
Right, that was Kwon Jun-wook, the Vice Head of KCDC, with Tuesday's afternoon briefing. So he touched upon cases at nursing homes, of course.
Right, that case related to a nursing home in the western part of the capital, Seoul. Earlier, I mentioned that we have a total of 9 cases related to that case. As one case, the first case was confirmed on Sunday, actually, and 9 others on Monday, which were added to today's tally. But now, according to Kwon, it looks like there were 3 additional cases reported past noon today, which brings the total now to that case to 12 cases. And that is why he also asked for continuous vigilance at nursing homes and other places, facilities where elderly people are. And also imported cases have been rising again to 25 today, which is why Kwon mentioned the exponential surges in cases abroad, especially as many of those people in high-infected, high-risk countries are actually coming to Korea, which is why we also have 6 cases from the Americas today, 2 from Europe, 2 from Africa, and 15 from Asia, excluding China. Meanwhile, he also asked for the nation's people to abide by social distancing measures during the summer vacation, especially to not move in large groups, but rather in small family members.
All right, so thank you for that. We'll see you back here on Wednesday.
See you tomorrow.
Right, in the absence of a vaccine against COVID-19, health authorities worldwide agree that testing is the best way to monitor and manage the pandemic. To this end, researchers here have secured a notable feat in efforts to further raise the accuracy of test kits. We have details up next.
In February, Korea became the first country in the world to commercialize quick testing kits that can accurately diagnose COVID-19 in just a few hours.
방역에 뚜렷한 성과가 나타나고 있습니다. 신속한 진단시약 개발로 감염병 대응의 첫 단추를 잘 끼워주셨기에 가능했습니다.
Korean-made test kits have now been shipped to dozens of countries across the world and have become an essential tool in the global fight against COVID-19. A total of more than $220 million worth of Korean test kits have been exported over the first 4 months of 2020. The test kits utilize a gene amplification system in which small pieces of DNA called primers tag specific sections of COVID-19's genetic code and duplicate the sequence millions of times, which release fluorescent signals that indicate the presence of the virus. The reliability and accuracy of many COVID-19 test kits have often come under question. But the development of this new genetic reference material by Korean researchers may help ease some of those concerns.
유전자 표준 물질 저희 만든 것은 이제 실제 코로나 바이러스 유전체에서 우리가 표준 물질로 쓰고자 하는 그런 유전자 부위를 골라서요. 그것을 이제 증폭을 하고 이것의 양을 정확히 측정을 하는 것입니다. 이렇게 정확히 정량된 표준 물질은 우리가 그 표준 물질 안에 있는 유전자가 정확히 얼마인지 알기 때문에
The quantity of the virus's genetic material that have been amplified allows us to directly compare different test kits for their accuracy and reliability.
저희 표준 물질이 있다면 이거를 위험성이나 위양성이 최소화할 수 있는 그런 기준선을 잡을 수 있게 되겠죠. 실제로도 현재 저희 연구원에 그런 표준 물질 구매를 위해서 여러 업체나 이런 관계자들이 연락을 오고 있기 때문에 아마 관련 산업 분야에서 많이 활용될 수 있을 거라고 생각이 듭니다.
In addition to improving the reliability of existing test kits, this material could also aid in the development of all new diagnostic techniques. Whereas the previously developed reference material from China only contained around 10% of the COVID-19 genome, the latest material unveiled by Korean researchers contained 90% of the virus's genes, meaning it can still work in the case of mutations.
그동안은 코비드-19의 일부 표준 물질을 해외에서 사오거나 질병관리본부 식약처에서 RNA를 분주받아 썼었는데 이번 표준연구원에서 이런 국가적인 연구소에서 표준 물질을 만들었다는 거에 대해서는 굉장히 일선에 있는 회사로서는 반가운 소식이고 많은 도움이 될 것 같습니다.
The Korean government is pushing to have its RT-PCR testing method recognized as an international standard by the ISO within this year, which will further solidify the popularity of Korean-made test kits.
K-바이오, K-방역, K-진단을 글로벌 탑으로 이끌기 위해서는 정부와 지자체, 그다음에 학교와 연구소, 기업들이 합심이 되어서 한 마음으로 끊임없는 노력을 통해야만 세계 인류 K 진단을 자리매김할 수 있을 것 같습니다.
We turn now to Latin America, where the daily death toll remains high, as do the numbers of confirmed cases. The Republic of Colombia, for its part, has recorded more than 200,000 infections and almost 7,000 fatalities. For more on the situation there, I have the Korean ambassador to Colombia, Chu Jong-yeon, live on the line. Welcome, Ambassador Chu.
Hello, thank you for inviting me.
You're very welcome, Ambassador. Now, the Korean government recently pledged $5 million to help Colombia fight COVID-19. Please tell us more about this pledge.
The Korean government designated Colombia as one of the priority countries of cooperation for COVID-19. According to that, we decided to offer $5 million of aid package to Colombia. I believe that there are two main reasons in this cooperation. First, Colombia is the only country in Latin America that sent its troops to the Korean War. Young Colombian soldiers sacrificed their lives and preserved the freedom and democracy of our country. Although not sufficient, I believe that our cooperation is an expression of gratitude toward Colombian people. Second, strategically, Colombia is an important country for us. The size of the population of this country is around 50 billion, exactly the same size of Korea. Colombia has abundant natural resources. Also, Colombian leaders regard Korea as its model of development. I believe that all our cooperation will eventually strengthen our bilateral relationship.
Right, Ambassador, I hear Korea and Colombia have been working closely to better tackle the outbreak in the Latin American country. What exchanges have there been so far?
It is well known in Colombia that Korea is a great example of successfully fighting against COVID-19. Under these circumstances, the President of Colombia, Iván Duque, and Vice President Marta Lucía Ramírez have requested by phone sharing our experience to our President and Prime Minister respectively. As a follow-up, we have conducted various rounds of virtual conferences between the experts of both countries. A few days ago, it held a web seminar regarding economic policy under the pandemic, organized by Inter-American Development Bank. On the other hand, we have donated 40,000 face masks and nutritional supplements like vitamins for the Colombian veterans and his family members. It has been very much moved by many calls expressing gratitude from them. I hope that the bilateral cooperation in the healthcare will be further improved.
Ambassador, granted, compared to its neighbors like Brazil and Peru, Colombia is doing better. Yet, when considering the reality that the lockdown there was adopted back in March, Colombia's containment efforts have not been as successful. What do you believe is the reason for this?
It is a little bit difficult question for me, but I think we need more observation to answer that question. However, if I say my personal opinion on that, I could point out roughly 4 points. First, although this is not the only case in Colombia, I think that the open-minded culture in Latin America somewhat contributed to the surge of COVID-19 in Colombia. Second, the informal economic activities, which amount to around 50% of national economy, is also one of the reasons of the actual aggravated situation. This might reduce the effectiveness of the control of the government. Third, the Colombian government had to reopen several economic sectors amid fear of the economic recession that might have caused the widespread of the virus in the society. Fourth, I believe the most important reason could be the weak infrastructure of the medical sector in Colombia.
Ambassador Chu, there is also some alarming news about armed rebel groups imposing their own brutal lockdowns across the country and killing those who disobey them. Is this true?
Yes, the political situation in Colombia is now a little bit complicated. The Colombian government and the FARC, F-A-R-C, the biggest armed guerrilla group, concluded the peace agreement 4 years ago. This officially terminated the 54-year-old internal conflict. However, some dissidents of FARC who didn't accept the peace agreement continue to operate, and another armed guerrilla group called ELN is still in control of some areas. Moreover, some drug cartels are operating actively. These groups are mainly present in the border area of Venezuela and Ecuador. Fortunately, most of Koreans in Colombia reside in many cities, such as Bogota. Our embassy is constantly informing Korean residents of the safety information to alert them and keep them safe.
Right, Ambassador. We continue to pray for the safety of all Colombians. All right, Ambassador Chu, thank you very much for making the time to share your thoughts with us live at this hour.
Thank you very much indeed.
생산, 수급 각 단계별로 국가 간 극심한 경쟁이나 연합 등이 일어날 가능성도 있습니다. 그만큼 백신의 확보도 상당히 난제입니다.
We know that the Russian intelligence agencies have been targeting, in terms of cyber attacks,
The race for a vaccine against or cure for COVID-19 has led to fresh concerns about nationalistic tendencies in the global arena. For more on this reality, I have Dr. Kim Seung-taek from Institute Pasteur Korea here in the studio. Welcome, Dr. Kim.
Good afternoon. Nice to be here.
And I also have Professor Im In-jung from Koongju National University. Welcome to the program, Professor Im. Dr. Kim, the current treatment options that are considered to be effective and safe for COVID-19 are remdesivir and dexamethasone. Please tell us a bit more about these drugs.
Well, both the drugs are known to be effective in the treatment of current COVID-19 because those effects are actually supported by the results of very rigorous clinical trials. And then, for example, the remdesivir can reduce the recovery time of people hospitalized with COVID-19 from 15 to 11 days. But the dexamethasone reduced the death by 1/3 or 1/5, depending on the different cases. But these drugs are not for the older patients with COVID-19, and then these drugs can be used for the patients with the severe COVID-19. And there are actually other numerous clinical drug candidates still under clinical trials. And we have to wait for the final results before we can say, well, some drugs are very effective. And anyway, based on the outcomes that I have received so far, I am expecting some good outcomes from some convalescent serum, which is for the plasma therapy, and then monoclonal antibodies. And lastly, it's a new drug called EIDD 2801. And especially this last drug is very interesting because this is very similar to the remdesivir in terms of mechanism of action of the drug. But this is orally available, and this is quite different from the remdesivir. Remdesivir can be administered by the injection. So this injection method is usually for the severe cases. But this oral drug, maybe just just a good drug candidate, but obviously we have to wait for the results of the clinical trials.
So we have to be patient.
Sure.
Professor, the US is facing criticism at the moment following a deal struck with American biofirm Gilead Sciences, in which the former secures 90% of the global supply of remdesivir. Do you suppose this is perhaps a manifestation of the Trump administration's America First policy?
Very unfortunately, but yes, it is. I think so too. Mr. Trump, President Trump, that so-called America First. It's not only just a slogan, it's already policy of the country, and I think it's a strategy for the country too. Even before, again, the coronavirus pandemic, all this, like, for example, global political competition has been getting increasingly serious. So having had these kind of situations, again, America prioritize their own sake first than any other, even alliance partnership. So for this case too, it looks like they are prioritizing their own survival, but which is somewhat understandable to me, because if you think about the number, which is outrageous compared to any other country. It's, as just the other reporter just explained a few minutes ago, it's now approaching 4 million, again, the confirmed case, which is, again, outrageous. So in some senses, I have some sympathy, but which is very unfortunate for, I think, for the globe and for the human being. Mm-hmm.
Of course. Mm-hmm. Dr. Kim, has there been similar phenomena in the past of countries hoarding medicine amid infectious disease outbreaks? And could you tell us more about such cases, if there have been such in the past?
Well, I think the current COVID-19 pandemic is a very rare event, and a very similar situation actually occurred just 100 years ago during the pandemic by Spanish flu. So, obviously we don't have any just vaccine or any therapeutics at the moment. So although there are some similarities, if I just recollect, although the situations are a little bit different, there were similar cases in the case of AIDS and hepatitis C. And then there were actually very potent antiviral drugs, but the drugs were very expensive. So and then these diseases are really different from the current COVID-19 in terms of, although this is the viral infectious disease, but this is not such an acute infection. So the cause is a chronic infection. So it's a relatively just a less urgent situation, but the cost was the issue. So many, poor countries and poor people actually had some difficulty to access these drugs as well. So but the current pandemic situation actually demands very fast and the development and the access to those drugs and the vaccines. And if any country just takes all available drugs and the vaccine, that would actually lead to another global disaster. And the people who need those countermeasures most urgently and desperately, for example, just the old people, might have some a problem, and then they would not just take the countermeasures in time.
That would be really tragic then.
It is.
Professor Im, let's turn our attention now to the actual efforts out there to secure an effective and safe vaccine or cure. What can you tell us about such endeavors so far?
First and foremost, as a specialist for international affairs, not again all these medical things, I do see again this familiar cooperation and at the same time a kind of brand new cooperation. For example, again, the U.S., of course, U.S. does have several companies, including Pfizer or Moderna. They do have several competitive companies, but they collaborate with, for example, Germany, which is again a lie, or they invested in a French company, Sanofi, as far as I remember, Sanofi, which is another probably trustable country from their point of view, or China. These are pretty much more how would you say, familiar partnership, which is reminiscent of a Cold War oriented or lie. But at the same time, we do see China's new approach to the Brazil-like country, again, that they're going to try to have a clinical trial in Brazil if they have some sample. So this looks pretty new, but if you think about the China's influence or their investment in the Latin America or Africa like new continent, again, this does make sense too. So what I'm trying to say is, again, in the deep in there, again, fundamentally, it does indicate, I think, who trust who. Again, the who wants to collaborate with the whom. Again, the partner means they want to share the burden and at the same time want to share the benefits too. So interestingly enough, again, from IR's point of view, we do see a kind of division here, which is again another probably unfortunate trend for whole globe or for whole human being. But that's, I think, another reality we face today. Mm-hmm.
Right. And speaking of an unfortunate reality, there have also been reports of clinical trials being conducted under highly questionable ethical standards. What are your thoughts on this, Professor?
Ever since the World War II, of course, we did experience Korean War, Vietnamese War, but compared to those kind of massive war, we did enjoy somewhat peaceful eras, decades. But because of this corona pandemic, now we face really critical juncture, which might bring in, again, the creative destruction. Again, everything is now, has to start from the ground zero. So from, how would you say, having had this kind of situations, all these hegemonic powers are really trying to compete, right? And the vaccine can be, of course, how would you say, it can be a lucrative business, and at the same, for the commercial purposes, and at the same time, it can be a weapon. It can be a diplomatic weapon, and at the same time, diplomatic tool for their potential partner or even potential enemy. Again, which is unfortunate, but I do see that kind of things. Mm-hmm.
Right. And given that kind of scenario, Dr. Kim, there are some people saying, given the scenario that Professor Im has also mentioned, who are saying that Korea should seek to develop its own vaccine or cure. What are your thoughts on this?
Well, obviously, it would be very good to have our own just the drugs and vaccine. But in reality, I think we need to actually just both approaches, because we cannot guarantee it whether we actually can develop the drugs and vaccines successfully. So although this is what we just mostly hope so. But while we are actually trying to just develop the drugs on the vaccine, we also have to try to get those good ones from abroad. We have to do both, actually, at this time. There's no guarantee.
And speaking about our efforts to find a vaccine here in Korea, how far have researchers here in the country come in efforts to find a vaccine or cure, Dr. Kim?
Well, actually, we and others are actually developing the drugs and the vaccines at an unprecedented speed in the human history, and this is very alarming. And then, obviously, there have been the very substantial progress up to this point. And then, as for the some plasma therapy that was talked about, and this is something that can be applied relatively faster than any other means. But the plasma therapy is dependent on the donation of the plasma from the patient who recovered from the COVID-19. And so there might be some supply issues in the future. Well, anyway, we have to be, again, I have to say, we have to be more patient. Whether we succeed in the development of just the drugs and vaccines is ultimately dependent on the results of the rigorous clinical trials.
Right.
Yeah.
Professor Im, President Moon Jae-in and a number of his global counterparts have called for equal global access to COVID-19 vaccines in the case that it should be found. How can Korea and the international community work to ensure that such equal access is available in the future?
Well, you probably remember Dr. Jonas Salk. He was the, how would you say, the father of the what is that, the polio, right? Polio vaccine. So he said, you know, I don't need any patent for my vaccine because could you patent the sun, right? Which is again the public good for everybody. But I think absolutely all these countries have to recall Jonas Salk, Dr. Salk's that statement and that spirit, but the reality is very, very different. Again, the US, UK, and China, these three countries are really competing. And having had this situation, as Dr. Kim mentioned, I also do agree with your view, because Korea also should not give up developing our own drugs and our own vaccine. But at the same time, I have to say this, I think, and I hope my country can show some, again, the good spirit to the rest of the world. And if we invent the vaccine, a good vaccine, I hope, again, the Korea can provide it for the humanitarian purposes. Yeah, absolutely. Again, Korea is a good model. Again, we already proved it for the quarantine and then test the kit. So again, I hope we can continue making efforts to accomplish that goal.
Right.
Yes.
All right, Professor Im, thank you for your thoughts.
you.
And Dr. Kim, as always, thank you for your thoughts as well. Right, well, that brings us to the end of this edition of COVID-19. Do tune in tomorrow to learn about the variables that could stem or spark further spread here and elsewhere around the world. In the meantime, do share your thoughts and inquiries with us via our social media accounts or homepage, arirang.com. Thank you for being with us today.